time to move across. That happened in the last session I was in. It had to start a couple of minutes later because some groups went over, some discussions went over, and then people had to rush round and things. So
right. Yeah, Richard, we were just too good at keeping to time on our last one.
I'm pretty good on time, but it's always 5 minutes by the time you go back to the agenda and work out what you want to go. It's not a lot of time.
I know. I was saying to someone that they were asking what Kiko Chat is, and I said, well, it's kind of like you're in the conference room, you're in the conference halls, and you're trying to walk around the hallways to choose where to go.
Yeah. It's a brilliant system, but it's just if you haven't looked at the agenda for a while, you have to kind of run back and see what's on that is the session that you wanted.
Yeah, absolutely. Okay, welcome if you're just joining us. We're just waiting another couple minutes for everyone to join. Okay. Okay. Welcome, everyone. I think we'll begin now. Amra, you ready? Thumbs up.
Do this.
Okay, welcome to the session today, everyone. This is Thematic Session 21, Building Resilience of Children and Young People During COVID-19. My name is Laura Lee. I'm a COVID-19 focal point with the Alliance, and today facilitating this discussion. Our speaker today is Amra Erdenalebig, and she is joining us from Mongolia. And Amra was born in Mongolia and studied in the US, receiving her master's degree in public health and working at WHO for a little while and returning back to Mongolia and starting with them in 2019. She lives there with her husband and her son in Ulaanbaatar. And she will be speaking about her experiences there today. So we really look forward to that. Okay, so as an icebreaker for those of us here, we're a small group. Please turn your videos on and pop it onto gallery view. Sorry, Steffi, I know you're making a cup of tea. All right. If it is morning for you, put up 1 finger. If it's afternoon, 2 fingers, and evening, 3. Or nighttime. Wow, what a wonderful representation around the globe. Now, put up the number of fingers for the number of cups of coffee or tea you've had today. Christine.
I'm already from 4 a.m. Yes.
Aren't you in the West Coast?
California.
Okay. Wonderful. And please, as Tiffany did, you're welcome to pop a introduction note into the chat. Okay, so welcome to our session today. Today's session is going to take shape of not just presentation and we're done. We're going to do an activity in the breakout rooms, and then we'll have some chance to do some Q&A and debrief. So that will probably just be 2 breakout rooms today. But we will first hear from Amra, more about what she has to share with us on adaptations of child helpline services in order to identify and support children at risk. So do keep your video on when we're having our discussions, and it'll be lovely to hear from everyone that way. And we look forward to moving forward. Okay, so welcome, Amra. Feel free to begin your presentation.
All right. Thank you very much, Laura, and also Richard for facilitating the session. And also welcome to all the participants for attending my session. Thank you very much. And today I'll be talking about initiating a Chatbox counseling service in Mongolia in regards to COVID-19 outbreak. So I hope you enjoy the session, and during the breakout sessions, I also hope to learn from you as well. So yeah, let's start. All right, so yep, as Laura introduced already, my name is Amr Baiskhadlan. I go by Amra for short, and I'm a child protection specialist, and I work for World Vision Mongolia. So today, today's okay. Laura, you wanna hop in?
I was going to say, Laura, so we have an extra. Here we are from Laura to add, if needs be. But I think we've already moved it.
It's okay, we can just go
I think we can move on with this group where everyone's organised, knowing what's doing.
Exactly.
We've had the overview of session. Thank you, Laura, for that. Okay. Keep moving on.
All right, great. Can you go back to the previous slide, please?
Okay, this one here.
Yes, great. Yep. Okay, so before I talk about the Chatbox counseling service, I think I need to talk about the Child Helpline 108. So as many of you may know, and you may already have this in your country, we also have it in Mongolia. It's a free and easy to access 24/7 confidential counseling and referral call services for children and concerned adults in Mongolia. It is a product of trilateral partnership between the government implementing agency, the Authority for Family, Child and Youth Development, also known as AFCYD, Mobicom, which is the largest telecom corporation in Mongolia, and World Vision Mongolia. It was launched in 2014 and has been effective ever since then. Next slide, please. So to give you a little bit of a brief overview of the situation of COVID-19 in Mongolia and how it has affected children, as of October 2nd, by the data from the Ministry of Health of Mongolia, we have a total of 313 confirmed cases, which were all transported via charter flights into the country. So fortunately, we are one of the very few countries in the world with no local transmission. As of October 2nd, we have had 307 cases recovered and discharged from hospitals, and 6 cases that are still being treated in the hospital. And as a result of the outbreak of COVID-19 in early of December last year, Mongolia shut down all of its international borders by the end of January. So with this, they quarantined all schools, all kindergartens, all colleges, recreational places, entertainment places, shops, and many places were running in shortened periods. So as a result of this quarantine, we had over 900,000 children locked in their homes without proper care and food. Next, please. So with the quarantine, we started seeing child protection issues due to the lockdown. And the data that I'm going to be presenting on this slide and the next slide are representative of data for the first quarter of this year compared to the last quarter of last year. So the concerning issues that we saw were children were left at homes without care and protection because parents, they still had to maintain their livelihoods. So they went to work and they locked their children in their homes without no meals. So with children of age 2 to 5 years, we saw 36.5% of them were left in their homes with no meals. And within this time period of January till the beginning of May, we have had a total of 8,970 children aged 0 to 17 years that received some type of services from the National Trauma and Orthopedic Research Center. And of these, 65.7% were related to injuries acquired in the homes. So these were mainly falls, electric shocks, burns, and things like that. So this was the report published by the National Trauma and Orthopedic Center by the end of April. And as reported by the General Police Agency, we have also had increased levels of drinking at homes, where domestic alcoholism increased by 30 to 40%, and domestic violence offenses increased by 61.6%. Next, please. Another issue was increased child rights violations and offenses. And as reported by the Government Implementing Agency, AFCYD. We have had a total number of calls on domestic violence made to Child Helpline 108, which increased by 108.8%. Child protection case response and management, as well as the working load of temporary shelters had increased by 115%. Child labor increased by 233.3%. Child labor mainly accounted for, working in herder families where children are sent to their, relatives in the countryside. So many children were working in the farms. Children who were staying in the city were begging or babysitting. They were doing daily wage jobs, etc. And also calls on reproductive and sexual health increased by 202.3%. So as a result of all this data, the government saw that we needed to take drastic and very urgent action in, tackling these issues. Otherwise, we were going to be in big trouble. So with this initiative, with this data in hand, the government approached World Vision and asked that if there was any possibility that we could address this issue, and with a Chatbox counseling service. So that's how the Chatbox counseling service talks began in April, and all the preparation work was done in May. So can we go to the next slide, please? So the Chatbox counseling service, it's a free online-based chat counseling and psychosocial support services for children and adolescents. The Chatbox is unique from the Helpline because the chatter and counselor interact simultaneously, meaning they message each other in real time back and forth. The chatter is always in control because he or she can connect to the Chatbox anytime she wants and end the communication at any time she wants. So and also there's a high degree of anonymity for the chatter, because the chatter, if he or she is not willing to reveal his or her location, then the communication is placeless. You can't put a face to the chatter, and the communication is also voiceless. And this was a very timely initiative because we have had many children and adolescents who lived with their perpetrators, and they could not speak right next to their perpetrators because they could be overheard, and they could get in trouble for that. So they could just be pretending like they're chatting to their friends or messaging each other, but report if they're actually being abused in the homes. So yep, next please. So the preparation, like I mentioned, the preparation work for the chat box was done in May. We have received services from our technical service organization, and the Chatbox counseling service was launched on June 2nd of 2020. So since then, we have had a total of 778 counseling services provided to children and adolescents and some adults by September 28th. But yeah, and when we analyzed the chat types, we saw that about 70% of the chatters, they received some type of counseling. About 10% reported child protection incidents, meaning they were then referred to, referral services, child protection case management. And then we have had about 15% requesting information on available child protection services, and the remainder were silent or test connection. And so when we analyzed, when we looked at the type of counseling services or the psychosocial support that these children and adolescents requested, we saw that, could you please go to the next slide? Thank you. When we analyzed the the type of services that they requested, we saw that most of them wanted peer and family relationship advice. They reported child rights and protection issues. They wanted advice on self-esteem in adolescence, loneliness, depression, fear and anxiety, self-harm and suicide attempts, cyberbullying, stress and anger management, career selection, and adults when they connected. They wanted advice and tips on positive parenting and child development. Next, please. And as with any new initiative, we've also had our challenges and limitations with the Chatbox counseling service. To name the top 5 from our list of challenges, the first one we encountered was the lack of capacity of governmental agents in child protection management. So although when we received a child protection incident, we reported to the governmental agency, but then the agents who were working on the case would, somehow lacked the capacity. So we've had some cases where, the family retaliated because the governmental agent told the family that the child had actually reported an incident, a physical abuse incident in the home. So with that, that was a challenge. And the next challenge we had was we had multiple chatters connecting at one time. So it was difficult for the counselor to effectively provide counseling services for all the chatters at one time. And we saw that it decreased the quality of the counseling service provided by the counselor. And it was also difficult for the counselors to tailor their services and advice because the chatters sometimes did not want to reveal their age or gender. And we have also had cases where children, the child or the adolescent was actually eager to talk to their parent to resolve any issues, any familial issues they had, but the parent was not interested, or the parent was not involved in the children's development. So this was an issue. And then we have also had children who were dealing with friends' suicide attempts. Next, please. So for the lessons learned and the next steps for the future, we need to have a monitoring tool to assess the results of counseling, so we can see if the counseling services, if the Chatbox counseling service is actually having the impact that we intend. and the referral system should be fast and effective. We need to regularly strengthen the capacity of our counselors. We need to secure and have a protective system from hackers. We also need to ensure the high literacy and accuracy of Mongolian language of our counselors, and experience sharing workshop with counselors from other countries who are also implementing Chatbox services. And also we need to have chatbots to save time and resources to commonly ask questions and problems. So just a short explanation on what a chatbot and a chatbox is. A chatbot is an automated artificial intelligence where a computer generates the answers for commonly asked questions. But a chatbox is a service where at the other end of the line, you have a real person giving you advice. So we saw that we need to have a chatbot to commonly ask questions. And I think that brings me to the end of my presentation. Thanks everyone for listening. Laura, do you want to take it from here, or should I?
Okay, sure. Thanks very much, Emma, and for the work you're doing. So we are going to move into breakout rooms, but first, Steffi, did you want to ask your question to Amra? We can clarify that now, and then we'll move to our activity.
Oh yeah, I was just interested, Amra. Thanks for a very interesting presentation. I guess I was interested because you were saying at the beginning that the helpline was a sort of a multi-stakeholder partnership, and I was wondering whether and it seemed as though, maybe I was wrong, but I got the impression that the government were very proactive about deciding that something else needed to happen and additional support needed to be put in place. And I guess I was wondering, do you think it made a difference to the government's response and the government deciding to scale up and to do something new because the government was already a sort of like a partner of the helpline? And I guess I'm asking that question because I know in many countries the government isn't a partner to the helpline. It's often done by an NGO and it's sort of can be quite separate. I mean, you may not know the answer to that. I was just interested if you had a view.
Yeah, thanks for the question. Actually, when the first initiated the Child Helpline 108, it was owned by Mobicom. It was a private, it was like a pilot testing. And then when they found out that it was effective, they handed it over to the government. So now the Child Helpline is a government service provided for children and adolescents. So the government, they had been, when the ASCYD is our biggest stakeholder or partner for World Vision. So they had been wanting to update their system for a child helpline. And the COVID-19 situation was the perfect situation, sorry to say, but it was the perfect situation for them to scale it up and have the Chatbox counseling service. So unfortunately, the data that is stored by Mobicom because of all the calls, but the government is actually the owner of the Child Helpline and the Chatbox counseling service. If that answers your question.
Yes, thank you.
Thanks, Amra. Thanks, Steffi. And hopefully we'll have time for a little bit more debrief at the end. So what Amra has prepared is a few scenarios that we can discuss in groups and then come back and debrief briefly. Amra, with our numbers and the time to debrief them properly, can we choose 2 of the scenarios?
Sure, absolutely.
Which 2 would you like to choose? That will determine which link they click.
Let's go with question 2 and 3, please.
Great. So Richard will create us 2 rooms, and the first room 1 will click. They essentially need to get to the 2nd and 3rd slides. So Richard, could you just pop the links in each of the rooms?
Yes, that probably is easiest actually, isn't it? So I've just put something in a chat which does give you links for lots of rooms, but I'll tell you what, we'll divide into 2 rooms and then I'll give you the links for the rooms. And Amara, you said question 2 and 3, did you?
Yes, please. Yes.
Okay, right. We'll sort that out. So let me just put you into 2 rooms now.
Very exciting to find out what question you get. See you there. And we'll have just under 10 minutes to discuss, and we'll bring you back.
Very good. So I've opened the rooms now and I'll be bringing the links in. Question 2. Question. No, that's not the right one. Hang on.
Richard, is it okay to share both of the screens, one after the other?
So how do you mean?
To share both Jamboards?
All right, okay, I'll get to those.
If it's not possible, that's okay. Welcome back. Thanks everyone for your participation in that. Which one are you going to try to share first, Richard? Question 2. Does someone from room 2 want to describe just in 2 minutes sort of what we discussed? So the scenario being considering possible partners to work with to establish a chatbot counseling service. And we thought about our own contexts as well as humanitarian contexts. Does someone from our group just want to come in for a minute or so?
I can go,
Thanks,
Laura.
Tiffany.
Tiffany. So I think the 3 of us we were currently living in Western context. We had Sweden, Germany, and the US. And so our contexts were a bit different. But we tried to think of general companies or institutions or things like that, partners. So we came up with social service institutions, the Department of Children and Family Services, that's what it's called here in the US, but there's ministries of family and child affairs or things like that in other countries. We thought about schools, even in distance learning and informal education settings as places where the chat box could be communicated or information about it could be provided. Local NGOs with street workers, social workers, case management people, and then the municipality of social services again, another social service institution. So that's what we got for our group from a very specific Western context.
Thanks, Tiffany. Amra, do you have anything to add or comments on that before we have the other group go?
It's been like over 5-6 years since I've moved back to Mongolia from the United States. So some of the things Tiffany described were reminiscing of the things that I studied in the States. So yeah, thanks for your comments.
Thank you. And the third question with the second group, one of you, yeah, Richard.
Yeah, so I'm going to put it up on the screen as the question, as it were. So I don't know whether anyone wants to comment on the question.
Okay. Could someone from that group just tell what your group was sort of chatting about in a nutshell?
Actually, in our group, we also touched on question number 2. So we were discussing partners and talking more about the security of the information. And we also raised an important thing that, for example, Mobicom being at the beginning, the owner of the information, what are the ethical considerations are there for the data that was managed, and then told us that the government now has the full kind of data management function on the government side. So sorry if we didn't go to question number 3.
So Laura, you're muted.
Not a problem. Does anyone else from that group have comments to add? We all discussed the importance of partnership around around helplines and chatbots. Okay, so let's look at this scenario. Oh, it just went off.
My apologies. We'll put the scenario back up. There we go.
Okay, child B has been under constant abuse from his family and repeatedly communicated with counselors at the chatbot service. However, they refused to share their location for fear of facing retaliation from family and community. How can Child Protective Services reach this girl and other children facing similar situations? And there's a gamut of ethical issues here. Does anyone want to comment on this?
I mean, I'm happy to chip in if nobody else wants to. I mean, I think this is one of the challenges with the chat box service anyway, in that you're automatically only targeting children who are old enough to use a chat service and actually have the level of communication to be able to do that. So I think that's an issue with reaching children sort of generally, because obviously you need to be literate, and you, to a certain extent, and you need to have technology and things like that. And I think we also have to, I mean, one could start to think about, is there ways that we could trace the child's call and you know, but my experience of working on helplines is that's almost always disastrous when you do that, and it almost always puts the child in a position where they just deny everything anyway. So it's kind of like pointless, because not only are they then not only are they then left in a dangerous situation, they're also left in a situation where they then feel they can't speak to anybody, because the people that they were reaching out to and were talking to, they no longer have any trust in. So I guess for me in this sort of situation, it would be more about trying to perhaps really sort of regularize that kind of communication, and hoping that we could move the child, you know, to regularize as to try to have some sort of regular contact with that young person or child, and try to move them towards, like, first of all, think about a safety plan, and then try to, over time, sort of chip away at this reluctance, and, you know, maybe hoping that continued engagement might mean that they'd end up saying, well, now actually I do want to help. But I think it's always a difficulty. Yeah.
Absolutely. Thanks, Steffi. Any comments back on that, Emma?
Yeah, thanks for that. Because actually, this is one of the difficulties that we're facing with our chat box, because we have had some case instances where children, they revealed that they were under abuse, but they did not want to reveal their location. So, you know, I also wanted to explore that, you know, how other countries are, you know, dealing with similar type situations. So, yeah, thank you.
I mean, there are sneaky ways that you can do it. So you can say, you know, it depends what sort of services are available. You can ask, you know, could you tell me the rough area that you're calling from, so I can see if there's anything that might be more local. I mean, that's a bit of a sort of sneaky way, but that still gives someone a chance. But I mean, short of someone going around knocking door to door in every house, I mean, or doing that awful tracing, and, you know, I just think that would be even worse for a child. I mean, you'd have to really think it was a life or death situation to sort of trace and to get someone, and it'd probably take weeks to do anyway. So yeah.
Sure. Thanks for that, Steffi, and exploring that. And thanks everyone for your participation in that activity. Amra, I wanted to give you a chance for some final thoughts, and then I can close our session up.
All right. Thank you everyone for attending this session, and I hope that it will be useful for some of you, and maybe to whoever will view this recording in the future. And I'm just honored to be presenting during the annual meeting. So thank you very much, everyone. Thank you, Laura and Richard, for facilitating and taking care of all the technical stuff. So yeah, thank you very much, everyone.
Thank you so much, Amra. I'd like you all, as we leave, to put one word in the chat box, this chat box, of something that you will take away from this session. Okay. And if you refer to the screen there, there's some resources. there's a technical note on child helplines that you could access, and we've put the link there as well for the technical note from the Alliance. And if you go to the COVID-19 resource page, you'll see many resources that are grounded in the child protection minimum standards as well, and have been worked on through the interagency process. So once again, thank you so much for joining us. I see innovation, inspiration, partnership coming up. Thanks for your participation, and wishing you all well in this meeting. And thanks again for sharing with us, Amra.
Yes, thank you, Laura. Thank you, everybody. And please make your way directly over to the plenary space in KikoChat for the wrap up. So if you could leave this Zoom, I'm going to end it. And in KikoChat, click the green button to join the Zoom meeting once you're there, and see you in the plenary space. Okay, goodbye from here.
Thanks so much, Richard.